Hello and welcome to YNOT Health. Today we'll be talking about eating disorders, uncovering its causes ranging from biological to sociocultural and raising awareness on the complexity of eating disorders or ED. Trigger warning, in this video we will be discussing eating disorders and their causes in depth. Please only watch the video if you feel safe and comfortable doing so. This video is meant to provide information on how eating disorders may have developed from and is not intended to be used for diagnosing an eating disorder. We at the YNOT Health team would like you to note that not all people with EDs will experience all the possible causes described here. If you have or suspect that you may have an ED, please seek help and consult a professional. Firstly, what is an eating disorder? They are a range of psychological conditions that cause unhealthy eating habits to develop, and they might start with an obsession with food, body weight, or body shape. The most common examples are anorexia nervosa, AN, the refusal to eat, and bulimia, BN, binging and purging. 20 to 40% of eating disorders may not fit these and are classified under other feeding/eating disorders. Although eating disorders can happen in all genders, they are 10 times more prevalent in females than males. The causes of ED are difficult to pinpoint, especially because it is impossible to conduct true experimental research, and surveying about ED in large populations come with self-reporting. They tend to be complex and can interact and overlap with one another. Biological causes are a major reason, and specifically, genes have a clear influence on the behaviors which lead to an ED, but it is unclear as to how. 50 to 83% of variants in anorexia and bulimia is genetic, showing that they are highly irritable. Similarly, twin and adoption studies show that there is moderate to high irritability of the three main forms of eating disorders. There may be other neuroendocrine factors as well. Neurocognitive processes also affect EDs. One of them, cognitive flexibility, is the ability to move back and forth or shift between multiple tasks, operations, or mental sets. Research consistently shows that patients ill with anorexia tend to have impaired performance on cognitive flexibility tasks. The other, inhibitory control, is the behavior of suppressing, inactivating, or overriding a relatively automatic response in favor of a less automatic one. Likewise, its deficits are most commonly seen in binge eating or purging behaviors. Social cultural factors play a huge role as well. The cultural idealization of thinness is correlated with increase in anorexia cases and demonstrated by rates of bulimia increasing in countries exposed to Western cultural ideals of thinness. However, EDs are not present in all cultures at all times. They flourish while thinness is ideal, and thus when food is not scarce, although this does not mean food abundance guarantees an eating disorder. It also depends heavily on the individual whether or not they take this to an extreme and the extent to which they internalize the ideal of slimness. Moreover, social media exposure and thin ideal internalization has increased the risk of EDs. Greater media exposure prospectively predicted the onset of an ED in adolescent and young adult girls, but there are pre-existing factors, genetic and environmental, that predispose certain people to be more likely to internalize than ideals. Programs like the Body Project, a group-based intervention program, are shown to have altered neural responses to thin ideal media images and statements, thus helping reduce the pursuit of thinness. This shows that such social media campaigns can work to change our understanding on the importance of skinniness for the better. Families can often aid in development as well as perpetuation of an ED. Eating disordered families tend to be intrusive, hostile, neglective of a patient's emotional needs, or over-concerned with parenting. Low family communication and sexual or physical abuse often precursors of ED2. In particular, mothers' critical comments on body weight and shape of their daughters serve as a high predictor of ED in daughters later on. Mothers who themselves have an ED tend to have a negative influence on their children's attitudes and behaviors through feeding them irregularly, using food for non-nutritive purposes, and expressing concern about their daughter's weight as early as the age of 2. Stress and negative emotions are antecedents for EDs, as seen by how binging is used to elevate moods while purging is to relieve guilt, discharge anger, or avoid weight gain. There may be an individual risk factor which could lead to having an ED. Negative experiences such as teasing, bullying, and sexual emotional abuse may cause an ED because they undermine one's identity and lead to intolerable emotions. As a result, EDs are used as an unhealthy coping mechanism to construct an emotionally controlled sense of self-focusing attention on weight, eating, and body shape. Feelings of low self-esteem, body dissatisfaction, and dissociation, along with abnormal thinking patterns such as making inaccurate judgments or having obsessive thoughts, can speed the process of having an ED. 74% of ED patients spend more than 3 hours per day on obsessive thoughts. 42% spend more than 8 hours per day. Certain personality traits, especially those of negative emotionality, are also alarming. Overall, the circumstances surrounding disordered eating are complex and variable. An eating disorder is not a choice and can be a result of a multitude of social, biological, and cultural factors. We hope that this video provides you with more clarity around eating disorders and their causes. Eating disorders and disordered eating behaviors carry significant health and medical risk, so do not be hesitant to seek help and always remember to consult with a medical professional to ensure your well-being. Thank you for watching.